Good day, ladies and gentlemen. Welcome to another episode of CoinNewsExtra interview session, a program where we invite innovators, stakeholders, and influencers in the blockchain, fintech, and crypto ecosystem to come talk about their points and the state of the ecosystem. So today we'll be talking about need for blockchain in healthcare, and I have an expert in this area with me, Vincent Rey Vicente, who is a blockchain advocate. He's joining us from Texas. Vincent, you're welcome to CoinNewsExtra.
Hey, how are you? Thanks for having me. I really appreciate it. It's an honor.
Yeah, it's our pleasure to have you too. Thank you very much for bringing our time to joining us. So before we move straight to the topic we're going to be looking at, I'd like to get a brief about yourself and your background.
Sure. Let me see. Let's go first with my profession. I'm a physician by profession. And with regards to blockchain and cryptocurrency, I started with crypto since 2016, but got scammed with different HYIPs or high yield investment programs. So I dig more on what cryptocurrency is because I think there's more to it. And that's the reason why I went into blockchain, started endorsing knowing what blockchain is. And at present, I'm a faculty member of Althash Blockchain, a blockchain online university.
Interesting, that's a very nice background. So we'll be looking at knowing very well you have experience in this area, need for blockchain in the healthcare. We'll see what is happening in the world today, the pandemic that is affecting everyone around the world. So it's a very good topic to talk about, most especially in this time of trial when we come to healthcare. So when we talk about healthcare, what is the rate of application of tech in the healthcare sector?
Well, there for me, I'm just looking at where the problem is. So looking at the healthcare sector, which I was really involved with, I go back in the Philippines. I identify what problems are, and number one problem is authentication of birth certificates, and number two, authenticity of medical records and medical certificate. And blockchain has a big way to solve those problems, especially of authenticity, security, and immutability. So I think that's where we are and where we're heading. And at the same time, the supply chain we're in, we got to know where the source is. So blockchain could really address those issues.
Interesting. Also, we are looking at if there is enough application of tech, is there any need for blockchain in the healthcare sector since there are other technologies that this healthcare look towards to?
Yeah. Here's the thing. I'm more of a use case guy, so that we could have a good application where blockchain and healthcare is being used. So can I share my experience there in the Philippines? Is that okay?
No problem. Go ahead.
Okay, and I hope I could answer your question. Anyway, one of the problems is people are trying to falsify their medical certificates, and that's a big loss for a company because if an employee tries to falsify their medical certificate and they're given extra, work leave, and that's the thing. Now, if it's in blockchain, the company, the doctor, and at the same time, the person itself has the control of the data, and it could be checked. And that's the reason why we were trying to have that, and we did submit that to the community, the fellowship or College of Occupational Medicine, where they could use it. The other thing is I did mention the birth certificate, and the one problem is just getting the birth certificate. It takes a long time having one. So if it's in a blockchain, once a person has its private keys, then they could really access it and have the government scan the birth certificate and they could get the data. So that's one of those things that the use cases and the application of blockchain in the healthcare, plus the COVID thing, which is I'm sure you have interviewed a lot of people for for COVID or health blockchain based projects.
Yes, we've done that. So thank you very much for that nice contribution. So let's look towards the future now. We see what blockchain is doing in different sectors, the finance sector, and looking, you've been able to mention what it can do in the healthcare sector when it comes to birth certificate and other things. What would you say is the future of blockchain in the healthcare sector?
There's a big future for healthcare, and there are certain issues that needs to be clarified, such as having blockchain in healthcare as a source of, data storage, which is not, because it needs a huge volume. There are other platforms that could address that, but in terms of security and immutability, 5, 10 years from now, there is a big need for blockchain decentralization and even the supply chain, wherein we would be able to identify where the source of medicine came from, if it's, authentic or not. If so, 5, 10 years from now, blockchain has a big impact, but it has to go to a certain process wherein its, application should be well thought of and where it should be really applied with.
Interesting. Before we draw the cutting on today's episode of Coin News Extra interview session, Vincent, I would like to get your closing remark on this.
Okay, you know what? It's been a hectic and busy day for me. My Facebook account has been hacked, and that's the reason why it's a good time that we have this conversation, because uh, privacy security can be addressed by blockchain, immutability can be addressed by blockchain. It needs some certain, advocacy and people to learn what blockchain is, and that's the reason why we are here. Healthcare is one of those areas that blockchain could really affect. Big impact. Future of blockchain in healthcare is uh, big. That's my only word, big, 3 letters. So I hope a lot of people could be able, to see your advocacy, and they will know what blockchain is. So thank you for having me here, and God bless you all. Stay safe, be safe.
Thank you very much. It has really been an amazing time out with you, Vincent Rey Vicente. You are a blockchain advocate. Thank you very much for bringing out time to joining us today.
My pleasure.
Yeah, yourself.